I want to big yashkar to Rabbi Aberlande for agreeing to give us the shiur. Rabbi Aberlande, we have a smallish crowd here today, but people that was will learning, and it's part of the beauty of סידני. It's Mikol Achugim over here together. So just Rabbi Aberlande is Choshev Rav in Monsey. Is the Rav of Heichel Menachem in Monsey, Mechaber of many Svarim, Pidyon Ben Kil Chossa, Svarim and Tefillah. An editor and a writer in a Torah magazine that comes out every Torah book actually that comes out every few months, or Yisrael, and it's a big schus for us to have him. On a personal note, I need to give a big yashakayach to Rabbi Aberlande for helping me out a lot of times, and he's always available, always accessible, and I'm very makir tov. So the purpose of today's shiur was to give a shiur to Rabbanim on Inyanim to do with Yom Kippur, a little of hadracha to all the shilas that come up on Yom Kippur, around Yom Kippur, around fasting, v'chulu. And all these shilas come up all the time, so I thought it would be nice to get a bit of clarkite and hadracha. We all have learned the simonim and Shulchan Aruch, hopefully we know the basic inyanim, but to get a bit more in depth, all the practical shilas and how we apply these things, bizban neima. So Rabbi Aberlande, yashakach, and it's over to you.
Okay, thank you, Rav Berari, and good evening, and by you it's good morning, good afternoon. It's a gewaldige chshivas to talk to Rabbonim, Moirei Ruas, which basically are Mezakes Harabim, is a tshuva in Miglas Merkuchim, from Tzeile Maruf, which he writes, he is Legave, he was the first person who made Chole Yisrael. So he used to send people to be a half a year in a farm without minion, without anything. And the people used to complain that basically it's, without minion, without everything, what will be with me? He said to be Mazakes Harabim, one time is more than 1,000 times doing a bunch of mitzvahs. So zit you all Rabbonim Aziki Harabim, they are Avdes an Neus Lachem. It's a gewaldige chshivas. Okay, so we want to start. We'll give over the Nyunam, as Rabbi Gurari mentioned, the halacha everybody learned, but Pasha, the practical things which I was makabel. Is it clear?
Yeah.
Practical halachas to apply to what we had in time, which I was makabel for my rebbes, which I took smich and shimish years and years. So the first thing is we know that the chole sheyesh beskuna is a pekich nefesh, and he could fast. He shouldn't fast on Yom Kippur. Now, it's kedai to tell for all the people, the mespalim, all the people, the sha'alim who ask that any person which has any problems, that means machlas, in internal that means he has a heart condition, he has kidney condition, Crohn, all these things which have with digestive systems. A person which has infections and he has high fever. Person who has problems with the nerve system, nerve problems, or people who have diabetes, etc., which we're going to basically eventually get a little bit more in detail, or people who have low blood, hemoglobin in the blood, below 9. All these people, you have to tell them that, and same will go to elder people, that they have to speak to their doctor, to their general doctor, which they are going usually all year round, who knows their condition, and ask him a couple of questions before Yom Kippur. The first thing he has to ask if in his condition he's permitted to fast. Then, even if the doctor will say no, he's not permitted to fast, you got to ask him if it's enough to eat, only drink, or you need both. Because eating is a and drinking is a problem. And if you only need to drink, you don't need to eat, then it's also to eat. Third, you should ask his doctor if he eats l'shi'irim, as we're going to come to that, he has pochs v'kashir, if that will be enough for his condition or not. And that's very important to ask the doctor all these details in advance and not come Erev Yom Kippur as the Rav, because Erev Yom Kippur is hectic and you need a lot of Yeshiva Das to know all these things, all the proton. Now, he has to ask his doctor also how much fluid he needs in his body during the times. And the fifth thing which he has to know, if he needs medication, if the medication needs to be taken every day, specific, or he could play around 26 hours, 27 hours. That means if he could push it off till Motzi Yom Kippur, if he takes it right before Yom Kippur, if he could push it off till Motzi Yom Kippur, all these things he has to ask his doctor, a person doctor which knows his overall problems, his condition. Now the doctor is kedai if it's possible, it should be a fruma doctor. A shomer Torah mitzvah, because automatically he has the chshivas of Yom Kippur, and it takes even Kiyach Nefesh also seriously. It should be a fruma doctor. Now, even if it's not a fruma doctor, steht nicht Shulchan Aruch klar, a goy, a roife goy is neman. A roife goy is neman. So if it's not a yid, it's also neman. But the post can say that if you see, sometimes you can see a doctor which is basically mazalzel in religion, and so the first thing is going to say you don't need to fast. So such a person then, it's not kedai to ask. You have to ask a goy which has nemonas, which will think on the specific, but not take in, his zilzal which he has on religion. So all these questions he has to ask the doctor and come to the Rav, and the Rav will take the machacheshbon according to the information what he needs to do, what he should do. Now every year the doctor, the chole has to go and ask again to the doctor, because whatever he asked last year not necessarily applies to this year. So every year he cannot rely on the last year's psak and last year's overall report. He has to ask every year the doctor. Now, b'chalal it's kedai to say for people which have hard time fasting to drink the last 48 hours before Yom Kippur a lot of water. If it's possible, not only water which has electrolyte, like Gatorade. I don't know the name, what is it called in Sydney, but in the United States there's a water which is called Gatorade or Performance, which has a lot of electrolytes in it and has potassium, has everything which the body needs in order to be able shouldn't get dehydrated. And a person, most of the people, if they drink a lot before Yom Kippur, they won't have a big problem of fasting. Avada, a person which is sick, something else. But usually people, even, which we'll come to it a little bit later, even pregnant women, if they drink a lot before Yom Kippur, they won't have a problem of fasting if they drink a lot of water, and befrat if they drink a water which has electrolyte. So that's kedai to specific mention them that they should drink the last 48 hours a lot. A chole is not only a person which is actually sick now. If there is a chash korov, which the doctor decide that if he's going to fast, he's going to become sick and serious ill, then that's also considered chole that we have to go according to the halacha which we have by chole sheyesh beskuna. A chole which is a suffix, if he's a chole mesikten, and we don't have a doctor for us, since it's suffix kiyach nefesh, machilin oisa, you give him to eat and to drink whatever he needs, lefi hatzoyrich, how much he needs to his body. You have to evaluate, but since we don't know, at least we have to go on the conservative side. Now then we know the halachas of a chole said tzurchani, and then a chole which say tzurchani, even if he didn't say I need to eat or drink, it's only he said it after you asked him if you need or a drink, that's still considered a chole which said tzurchani, and you gotta give him to eat. That's basically the nekidus. The nekidus boifim kluli of a chole. Now, if you have, there's other halachas also which, first of all, I'm sure all of you know. And second of all, it's not too much like you have one doctor like this, one doctor like that. Usually a person goes to his doctor and he knows his Matthias. But it can happen if a person, for instance, in shul faints and there's a shul which has a lot of doctors, and one doctor says like one way, and another doctor says the other way. We know, according to what's doing in Shulchan Aruch, that one against one, you go always lehukl. Only in two, if you have two doctors which say that you have to eat, even you have 100 doctors say you don't have to eat, you still give to eat. It's only if you have three doctors, two doctors which say you don't need to eat, and one doctor says you do need to eat, and the chole also says, I don't know, then you're machmar. But basically, not that much negaya, but it's kedai to know the Allah if it happens such a way. Now, there is a nidden in the poiskim we had last year in our journal, a whole arichas. If you should, a chole sheyesh beskuna, if it's kedai that you should give him IV, intravenous, before Yom Kippur. So then he doesn't need to eat. Now, most of the poskim, if my Rebbe, the Baal Shai with the Leiver of Osner, paskent that a chole sheyesh beskuna does not need to go on in IV, and it should not go on IV. Since it's mutter to him for him to eat, then it's mutter, it's hitcha, and then he could eat whatever the Shulchan Aruch allows him to eat, and he does not need to go on IV. Bechlal, when you're going on IV, you're going into a lot of problems too also. Because sometimes it falls out in the middle of Yom Kippur, and putting it back, you're going into shalas, a fill of shalas of deraises. Because putting in the needle is could be a shala of a deraisa, because you want it, you need it, you want it to come out the blood, etc. So therefore, if you don't need to give, you don't need to do it, don't do it. You could give, you could eat. Don't give. You don't have to put IV for such a person. When do we say that you should give for a person intravenous? A person which basically is not sick, but we are afraid he might get chole sheyesh beskuna through fasting. So then, since he's now a buri, since now he's well. So in such a case, is yesh mukam to say that he should take intravenous. You don't have to, but that's already a mukam that you should say you should take intravenous. But again, everything has to be according to the doctor, because some doctors does not want, they're afraid of complications and infections. If the doctor permits, then you could put in an IV. Another person is kedai to put in an IV, a person which is chole sheyesh beskuna and he needs to eat, and he is a frimer, he doesn't want to eat, which basically is a frumer on Yom Kippur, but he's basically a Michael Gumen and Pekich Nefesh, which the Shulchan Aruch says that a person needs to eat and he doesn't eat. But there are some people which are machmer, and every year we have people which go into hospital after Yom Kippur because they're machmer and in Yonah, which they should not be machmer. But if you know that you have a person, an old guy or a sick guy, which will not eat because he thinks that's a chimra, then it's good to put him on intravenous because he's not going to eat. And it's a skona not to eat. So therefore, you could put him on intravenous. But just like that, you don't put a chole sheyesh beskuna on intravenous, because if he's mutter to eat, he should eat. A person which has fever. The first thing what he should do, he should take Tylenol. Because when a person has fever, the problem of having fever is he's going to get dehydrated. And once he gets dehydrated, it could be a problem in a skuna. So he should take Tylenol. We're going to get to it, how you take the medication. But first, he should take a Tylenol, and that would knock down his fever. And if it knocks down the fever, then he is fine. But if he takes Tylenol, it doesn't go down, and it comes to a matzav that he is already 102 in our, I don't know how it's in Sydney, the how you measure it. I think in Europe they measured, I think 39, but by us it's 102. Once you get to this stage, the Tylenol didn't work or it didn't work properly, then he should start drinking puches mikashir, mashkem, ibafrat, which has electrolyte, has a lot of energy. So that's good. He shouldn't get dehydrated. So again, once if he has fever, he should take a Tylenol. And if it's still by 102, or I think it's 39 in the European way, how they look at it, then he could drink water, and it's kedai to have electrolyte that shouldn't make him dehydrated. A person which sits in shul and he faints, which happens. Now, the first thing you should do, you should call Hatzolah. That's the number one, the first thing. You dial a doctor, you dial the ambulance, Hatzolah. But in between, if a person is possible, they should try to pick him up, his foot, he should when he's on the floor, the feet should be pick up the feet, because then automatically oxygen goes into his brain till he calms a little bit. If he calms and he gets up and he feels good, so then that means it's not a big problem. He doesn't need to eat or drink. But a lot of times it happens through, if after he gets up, or wakes up and gets to himself, he still feels very weak, or he has dizziness, lightheadedness, and basically you're afraid he's going to basically faint again, then pashtas, the problem is he's dehydrated. Then he has to drink water and no shirim. Nothing with shirim. You have to give him a lot of water. Again, if it's kedai, if he had access to water with electrolyte, that's the perfect thing. And on the first step, give him a lot of water, not l'shi'irim. Once he gets to himself, and he still needs to drink, according to a doctor or maybe a tzula member, then he should drink only puchsim kashir. But the first step, he should basically drink regularly. And if you have the tzollah comes and it checks his vital organs, whatever, and it sees that everything is okay after he faints, that means nothing happened. It was just, it happens, but it's not something major. And he could fast, finish the fast. Now, sometimes you have a person who faints, and basically if he goes home in his house and he lays down in his bed, if he has an air conditioning in the room, nothing will happen, and he could basically finish the whole fasting. If this is the case, then of course he should go home, lay down and sleep. He won't daven in shul, they won't have the Nesana Toikev, so he won't have the Nesana Toikev in shul. Or he will say it at home, and if he won't say it at home, at least at the Mekayim in the mitzvah Esther the rice of Inni, Yom Kippur, and not because of that he should eat. But that's only if a person, we know that he's basically fine and only he needs to relax in a cool area, then he should do that. But if we don't know, or if he's dizzy and has lightheadedness and is very weak, then you should make sure that he should drink. The same will go if you have a person which basically faints in shul, or he falls down and you see his face all changes. Punav nishtanu, Shekhanor is mentioned, and it's not to a real thing, but it could happen also in our time. If in such a case, then and Datzola, or even not in Datzola, most of the people who look at him feel that he is in the matzav of askona, you give him first l'shi'irim if it's possible, and if it's not possible, you give him regular to eat till he comes to himself. Very important halacha. Sometimes you have a person which is a chole, and the doctor says that if he's going to fast a couple of hours, then eventually he's going to have to eat a full meal. But if he's going to start the day eating puchas mikashir constantly, then he won't need to eat a regular meal during the day. Of course, it's kedai that he should start up the day right away eating puchas mikashir or drinking puchas mikashir. That in order it only stays a Issa D'Rabbanan, and he shouldn't come to a matzav that he should have to eat during the Yom Kippur a full meal, which is basically a Issa D'Raisa. Okay, that's basically which we had person who is has fever or faints. A person which is chole she'ayin baskuna. but he needs to take medication. He needs to take medication. If it's possible that he should take medication without water, of course, that's the best thing. That's the best thing. If he has a not good taste, as most of the adult medications does not have a good taste, so then if he doesn't have a good taste and he have no water, that's the perfectly best thing. But sometimes a person could not eat, drink, take a pill, take a medication without eating, without some water. So the first thing is like this. If you have a medication which you could have a suppository, so that's the best thing. Sometimes we have some kind of medication which you have a suppository, so that's perfectly fine, but that's not eating at all. But if you don't have, you have to have only medication which you take orally, and it doesn't have a good taste. So again, as we mentioned, take it without water, but sometimes you cannot take it without water. Then you can take it with water, and you put in a thing which makes it bitter. Now, putting in and making it bitter does not mean you're putting in lemon juice, because lemon juice is derech achila, to drink with water. Or anything which is decided to put in the water, which makes it a little bit bitter, that's not considered duver mar. Duver mar means you're putting in a thing which is not derech achila. For instance, putting in salt and quite a bit, that it should be taka really, really, really sour or salty. That's called duver mar, but not putting in a little bit to be yoitza. Has to be taka, has to be a thing which you feel it is a duver mar, and then you could use it with that, with water. But there are some time when a person cannot, he has to take the medication, but he cannot put in any duver mar. He cannot take it that way. Then he can take it puches mikashir.
Even for chole she'ein bo sakona.
Even, yeah, chole she'ein bo sakona, but chole she'ein bo sakona is only when he needs to take it. Let's say a person has a very, very hard headache, a big headache, and he needs to take Tylenol. He has to take it with putting in salt. Because but a person which is a chole she'esh b'skuna or a chole which needs to take medication, then in a time when he could not take it only with regular water, it will be Michael. But the person which has to take Tylenol in boivim, which is mitter, which is a very piping medication, piping headache, which will be matter, so we will matter without water, or putting in really salt water, but not regular water without putting in anything mar. Sometimes you have a person which needs to take a medication and he needs to eat it with some kind of food, yogurt or this kind of things. It happens, it's not common, but there are some people which they cannot take a medication, they have to take the medication, and they cannot take it without water. But now, if they cannot take it because they don't feel like taking it, that's not heter. Only if it's gonna make them in such a time that if he's gonna take without food, he's gonna get sick. There are medications which if you're gonna take it on an empty stomach, you're gonna get sick, and you might get chole she'esh b'skuna. So then you are permitted to eat puches mikashir. But again, has to be in a way, it's not just because, sometimes they tell you that you have to eat yogurt with a medication, which you could push it through. That's not a heter to eat. There are medications which it might affect people who have some kind of conditions. It might affect their digestive system, and it's impossible they should take it without some food. Then they can be Michael and take it with some food. Just a couple of other machlas which we need to discuss. First of all, we'll go to diabetes. People who have diabetes. Now, diabetes, we have two kinds of diabetes. There's diabetes 1, which is basically even in young people, which is a really serious diabetes. And then there you have diabetes 2, type 2, which is basically most elderly people, older people, and it's not that much of a skona if it's, you know, if you take care of it. If you don't take care of it, it's also skona. But diabetes type 1 is much more a bigger risk of a skona. Now, a person which has diabetes, he has to get clearly hairuas and from the doctor what he needs to do. Because such a person has to check himself for sugar constantly. So how do you do it? You do it the regular way. How you do it? Normally, you could check your insulin, but you have to do it with a shinny. That means you have to put in the needle with a shinny, and you have to press the button on the tester also with shinny, with your mouth or with other ways. How you do it? Shinny does not mean with your left hands. That's a mistake which a lot of people make. Shinny with left hand is not a shinny. It has to be other kind of shinny, and you have to do it constantly, and you have to do it. If not, basically, it is a big problem in mamash haskona. Now, if you have, it's possible to make a bdika, a check. You check your sugar through I don't know how we say it, bdikas sheten. When you take your urine and you put in a stick, and that checks the sugar level. Now, it's kedai, if you can have that kind of tester, that's kedai avad the best. Although some poskim will say that this is also a shalaf nadraisa because of tzvaya, but most poskim say since it's tzvaya only in lezman, it's not a isa daraisa. But at least do it with a shini, putting it in with the shini, at least for sure it will be a redrebonan. That will be the best thing if you do. But if you can do it, you do it the regular way with a shini. That means a regular test with the needle, with a shini, and then it goes into the rabbonan. But he has to test it. If not, it's a very big skona. Now, a person which is basically a millivium kipper, a diabetic, and it feels that his sugar level went down very low, he should right away drink, not l'shi'irim. He should drink regularly, because then it's mamash haskona, and he has to drink regularly, no shi'irim. If the doctor tells you that you are a diabetic, which is very perfectly fine controlled, and he gives you exactly orders how to take care of how to fast, then you could fast, but you have to get very specific orders how to break your fast, because a lot of times it's not a problem for the diabetic to fast, but it's a big skona when he breaks his fast and starts eating, then the sugar goes wild, goes crazy. So you have to make sure to get specific instructions, how to break your fast. Now, sometimes the doctor will say there's no option. You'll have to start eating in the afternoon in order you shouldn't go into a skona by fasting by unfasting Matzah Shabbos. Then you will have to eat according to the doctor, but at least you fast as much as it's possible. Because you have to remember, when a person has a heter to eat, he can only eat as much as he needs. If the doctor says you need X amount of food and more you don't eat, then you're not allowed to eat extra. So therefore, if the doctor will tell you that in order to be able to unfast Matzah Kipur, you'll have to start eating, let's say from 3 o'clock in the afternoon, l'shi'irim or whatever it should be, then you have to follow it. But if he says that you have to eat all day, then again, you gotta follow the doctors when it comes to diabetic type 1, because it is a very dangerous position. Diabetic type 2 is much easier, and therefore you again also you have to talk to your doctor. It's not a joke, but most of the times the doctor will say there's no problem of fasting, and sometimes even the doctor will say it's good for a diabetic type 2 to fast. It's healthy for them, but again, on fasting it's still a problem for them too, and they have to get specific directions from the doctor how to unfast and to break the fast, and then we are fine. Now, Baruch Hashem, today's day we have these machines, which I won't say most, but a lot of people, 50% people who's probably diabetic had this machine. So that's automatic in your body. You don't have to make any malacha. That's automatically checking and pushing in insulin as much as you need. So that's a gewaldige mile, a gewaldige brucha that we have in our days. Then we have people who are sick, and we we say leketchila that they shouldn't fast, which is basically anyone who went through open heart surgery in that year, a person which went through a stroke, a person which is basically Rahman Aslan has Rahman Aslan cancer or had cancer, he went through chemotherapy, mamish chemo. A person which had corona nowadays, a person which had serious corona, and he was in the hospital, or not even he was in the hospital, but basically he had to have oxygen, and he was really sick, especially by the elderly people. They have to, and they didn't get to themselves back to their koiches, their people should not fast. A person which has Parkinson's, a person which has what would we say, nerve problems, the nerve system,
Depression, you mean?
What?
Like very bad depression, is that what you're talking about?
Like very bad, he takes pills for
depression, Dikaon,
or a nerve, psychiatric pills. All these people, we say they should not fast, and they should eat puchas mikashir. They shouldn't even start to begin to fast. There are people are in a matzah in skuna, and they should, people which should right away start puchas mikashir. The other people which we mentioned in the beginning of the shir, they should ask the doctor, because they are not in a matzah of, we know that they are matzah b'skuna. They could be in a chole shesh b'skuna, but they should ask the doctor how to go about it. Pregnant women. Pregnant lady, a regular who has no complications, has no problems. We don't know of any problems which she had previous hapolot through fasting, or she didn't have any early babies, preemies before in the previous births because of fasting of Yom Kippur. A regular meberes is mechiyev to fast. Although there's a tiny percent of pregnancy which could end Rahman al-Islam through fasting, but that's mamash amiyat she'ayna mutzi. Chazal did not take it in consideration, and that's why Chazal said a regular meberes should fast. But again, as I mentioned before, they should drink a lot the path before Yom Kippur, 48 hours, a lot of water, and again, if it's possible, with electrolytes, is avadigit. And they should sit home, relax, have an air conditioning room, good cold air conditioning room, and you shouldn't have a problem of fasting. I always say for people, for young light, if your wife is pregnant and she fasts not so good, but she doesn't have any condition, and it's Yom Kippur, she should take a nap and lay in bed all Yom Kippur. And you should be home and babysit the children. Don't go to shul, don't daven with a minyan, because fasting Yom Kippur is a daraisa, and in order that your wife should be able to fast regularly on Yom Kippur, if she needs to be in bed, in the air conditioning room, and somebody has to watch the children, and the husband could fast fine, he should babysit, not the wife. But if she is vomiting a lot, and automatically once she's vomiting a lot, we have a problem and we are afraid of dehydration, then she should drink puchas mikashir. But this is only a regular pregnancy. If she had already previous problems, that means she had preemies right after Yom Kippur, or she had hapolot after Yom Kippur, she lost a child. The poskim say if it's twice, the fuch is twice, then she should not fast. Or any lady which is in a high risk pregnancy should not fast. The same will also be if she gets high blood pressure because of her pregnancy. That's already a sickness. I don't know how you pronounce it, but this is a sickness which it's called pre-eclampsia. This is a sickness already that she gets only high blood pressure only during pregnancy. But that means there is an underlying problem with her kidney or with her liver, or she has diabetic, because of the pregnancy. She got diabetes because of the pregnancy, and she takes insulin already. Such a lady, should not fast at all. But if she takes medication for diabetes, but she does not take insulin, then there are some times that she could fast, and she discuss it with the doctor. So again, if she takes already insulin, she shouldn't fast. If she does not take insulin, only takes medication, then she should discuss it with the doctor. Sometimes she could fast. A person which is pregnant with twins should, of course, speak with the doctor, because over there it gets more complicated, especially after the 5th month. So she'd ask the doctor. A person which is pregnant with triplets should not fast at all. And she should right away drink. She doesn't have to ask the doctor. She should right away drink because it is very serious situation. Lady which is basically in the 9th month, and she let me start beforehand. A lady which is pregnant and she goes into extreme labor, she goes into labor, then she should drink right away, because you have to stop the labor. You have to stop it. That's during the whole pregnancy. If she gets really heavy labor, she has to right away drink a lot, even a liter of water, because that will stop the labor. If she's in the 9th month and she starts to get labor, now it depends. If she is after the week number 39, then she shouldn't do anything, because basically, okay, she's everything is fine, and she is. If she's going to go into labor, she's labor. There's no problem. If she is before, that means till the week 38, and she goes into serious labor, strong labor, or she feels a big lachatz, pressure from the baby, then she should also right away start drinking a lot, because she has to have a lot of liquid in herself. Now, if she could wait at least 10 seconds between one sheer drink and other dry drink, that's fine. But if she cannot, then she should drink right away. She should even do less than 10 seconds. But if she could, at least she should wait 10 seconds, because we're going to see one of the shirim by drinking is kedai shir reviz, which is about 10 seconds. If she goes into labor, and not only goes in, she is going into delivery. That means she's already yeshevas ala mashber, which means it starts bleeding heavily, or she cannot walk anymore, or she has very strong labor constantly in that means 5 minutes in a row. That means, according to the Elev Lamata Imata Fraim, that's already considered a yeshevas ala mashber, and she should drink right away, start drinking a lot, because we don't want she should have the baby when she's dehydrated. Now, if she goes in right away to the hospital, so then she doesn't need to drink, because they right away will hook her up with intravenous. But if she doesn't go right away, it takes time, or she has it at home until the midwife will come, or whatever, all this situation, then she should drink right away, because it is dangerous to have the baby when she is dehydrated. Okay, so now let's go a little bit into shiurim. What is the inyan of shiurim? What is the side of shiurim? Now we know the Torah said that you cannot eat Yom Kippur. It has to be ini. Ini, ham Chazal gesucht, is if you eat less than kosevas, that's called already ini. It's still called ini. If you eat more than kosevas, which is a 2/3 of a bite of an egg, then that's already calms you down, and is also already min haTorah. That's the gaya achila. What is it in our day, in our time? Now, the shear, which is puchs mekesevas, that means we said, whatever we said before, that you should eat l'sheir and puchs mekeshir, that means you should eat less than 30 grams of food, which is basically an ounce of food. Now, that's why it's always kedai to say for a person which is on risk, and he or she might need to eat, she should have a schnapps cup. It's a small cup, which is 1 ounce. And that's the shear, which is still puchs mekeshir, puchs mekesevas. So therefore, you put in, you can eat anything which goes into this cup, even if you press it in, and you should press it in, because we don't want to count the air which is in the food. So you press it in, whatever goes into the cup, it is still puchs mekeshir. If it's not enough, you could go up till 38 grams too, because the other shirim is 38 grams. So therefore, till 38 grams, if 30 is still too little, give them till 38 grams. It's kedai when you eat, you should eat things which have a lot of calories. Shemenet, sour cream, cheese, what else? Chocolate, eggs, anything which is basically has a lot of calories, it's kedai to give to eat. Because since you eat, you have a shear, you might as well maximum out what you need to eat. So therefore, with a lot of calories, that's the best thing to do. If a person eats, let's say, in shore, he eats that, then that has a lot of energy. So again, you take a cup, which is 1 ounce, you fill it up as much as possible, and whatever it is fits in, that's puchs mekeshir. When it comes to drinking, it is maloi ligmaf. Now, maloi ligmaf goes according to that every person to his maloi ligmaf. That means how much it fits into his one side of his mouth. So, udem bainani, a regular person, it is be'erech 40 grams of water, which is 1.35 ounces of liquid. It is by a regular person, that's still considered puchs mekeshir. You have a small person, then it's 32 grams. So again, a regular person, it's 40 grams. A smaller person, it's 32 grams. I'll think this is still puchs mekeshir. Again, if you need to drink, you drink things which has a lot of energy. Water with electrolytes, milk, or orange juice, which has a lot of sugar or all these things. Don't drink any sweet soda, Coca-Cola, these things, don't stay away from it. It won't help you and it would make you even more thirsty. Drink whatever you need to drink, which is filled up with a lot of calories, a lot of energy. What is the shear that he or she should drink it, eat it? So the shear for eating is shear b'chadai achilas paras. Now we have a big machloikas. What is the shear b'chadai achilas paras? It starts from 9 minutes, like the Chassam Sofer writes, 9 minutes from eating to eating, from every 30 grams of food to every 30 grams of food. And it goes down all the way till some person would say 2 minutes is enough. The Tzemach Tzedek, which is the most accepted view, is it's 7 minutes. But then you have 6, 5, 4.5, 4, till 2, you have all kind of shi'urim. 4. So, askumas achroinim, if it's possible, you should take the Chassam Sofer shi'ur, which is 9 minutes. If you can, you're talking about the Isser D'Raisa, by the Raisa you go over the Gresta Chimra Shi'ur. That is basically 9 minutes. And if you cannot, then you start going down from 7 minutes and all the way. If you cannot, you go lower, but 7 minutes, that's the accepted shi'ur, but you can still go down less, till you have no problem to go down 2 minutes if you need it. Now, if you don't need it, you cannot do that. But if you need it, you go down even to 2 minutes. That is the negaya le eating. But when it comes to shtia, we have a machloikas. Some persons say that it is b'chdai, the time that you drink a revius, a kos revius yain, revius mashke, which is basically not more than 10 seconds. That means if you wait 10 seconds, that's enough. Other poskim say it is the same as food, and you have to wait, again, 9 minutes, 7 minutes, all this shirim. So the Alter Rebbe, the Balatanya, writes to Shechanoach Harav that Me'ikar Adin is the halacha that it is, shtia is kedai shtia servias, which is 10 seconds, but it says we should be machmar for the bigger shir. So again, if you can, you be machmar on the bigger shir. You start from 9 minutes all the way down till 2 minutes, and then if you need it, you can still go even till above 10 seconds, because that's Me'ikar the shir, which the poskim, right, that's Me'ikar Adin, Sai Shechanoach, Sai Shechanoach Harav. That's basically Me'ikar Alocha, it is kedai shtias revias. Now, so if you want to say for a patient or a mispalel or a congregant, to make it easy, you say, you take a schnapps cup, which has an ounce, you fill it up with food as much as possible, and you eat every 10 minutes. If she doesn't want to be the clock, every 10 minutes you eat this shir. When it comes to drinking, then you tell him that they should drink every 5 minutes. Why? Because the poskim say, although I want to correct one thing that you said before. Before I said, by drinking, we start with 9 minutes and you go down. No, the poskim say that although by eating, you have the shittas chasam soifer, the shittas tzemach tzedek, with other shittas, which goes on from 9, 7, the poskim say that even if we accept the most chimredige shitta, that means drinking is also kedai achilas pras, not kedai shtias revias, which is 10 seconds. You say it's the same thing as like eating, you can still rely on the poskim, which say achilas pras is 4 minutes. So when it comes to drinking, you don't have to be machmar more than 4 minutes, because according to a lot of poskim, 4 minutes is already kedai achilas pras. And Me'ikar Adin, Achshtia is Ikar Aluchi is Krashtia service, which is 10 seconds. So that's why when you say for a person that you want to make it in short, you say you could eat every 10 minutes 30 grams or 1 ounce, and you could drink every 5 minutes the shir, which is 40 grams or 32 grams for a small person. So 5 minutes for drinking, 10 minutes for eating. So that rounds up to make it easy to remember the time of kedai achilas pras. Now, if you need to weigh it or all the things you can do in Kippur, semedidu shel mitzvah, it is no problem to weigh it. Also, we know that achile ishti is nicht mitzaraf. So you could drink if you need. You could drink the puchs mekashir and eat if you need to eat puchs mekashir at the same time, because it's not mitzaraf. Now, if you don't need to eat, only drink, which is by a lot of sicknesses and sometimes also by meberes, you don't eat. Most of the time, you need to drink, not necessarily to eat. So then you only drink. But if you need to eat and drink, it's not mitzaraf. Now, there are some foods which the poskim have a sufuk, which if it's shtia or achila, let's say, for instance, yogurt or a soft-boiled egg, so therefore you shouldn't eat it together with other food and don't drink it with other food. That means we have a sufuk if it's achila shtia, so don't use it together with other shi'irim.
So can I ask the Rav Shaila where we're going?
Yes.
The Rav's giving measurements with regards to achila regarding the 1 ounce cup, but with regards to shtia, giving grams. I'm just confused because usually grams is a
It's an American thing, yeah?
Yeah, no, so just I'm trying to figure out grams is for us would be more of a weight thing for food, and an ounce would be much more something for drinking. I'm just a practical on the measurements. I don't know what 40 grams is in liquids.
The measurement is by eating, it's 1 ounce of food.
I mean,
which equals be'erech to 30 grams. It equals 30 grams. You're right. You're correct. The grams usually goes to, but it's a 1 ounce. Eating is 1 ounce of food, an ounce of food. That means 30 grams. Take it as much. So some people know it in grams, and some people know it in ounces. So that's why I said When it comes to food, it is 30 grams or 38 grams. And when you want to measure it, it's a 1 ounce cup, because 1 ounce cup is equals 30 grams. And when it comes to drinking, it is a regular person 40 grams. If you can measure in grams, which is in ounces, I think it's 1.335. I think it's 1.35. It's in ounces. 1 ounce, 0.35. So it's 40 grams and 1.35. And for a small person, it's 32 grams. I don't know how much it comes out.
That's I think a gram to milliliters in water. I think that's 40 milliliters of water. Rabbi Karori, that'd be correct, right?
Yeah, it would make sense because that's like much less than like a half of these. In other words, it's like, yeah.
Okay, thank you, sir.
So just repeat it in your measurement. You tell me it in your measurement.
Okay, so our measurements would be for food would be a 1 ounce cup. So it's what we call a shot glass amount, which is around 30 to 40 all grams. And then for drinking, it would be roughly for a small person 32 milliliters or 40 milliliters.
Milliliter, yeah, correct.
That makes sense, yeah.
By you is also ounces?
No, milliliters. No.
Oh, milliliters. Okay, very good. Because it's always confusing because in Europe they have one way, in America always has to be different, and the whole world they have something else. So this is basically is the cheshbonos of this thing. Okay, is there any questions?
Yeah, I have a few questions. So I'm just going to go through a few things. So I'm just a little bit confused about the nemonus of a non-from doctor or non-Jewish doctor, because I find a lot of times that the doctors are they want to cover themselves, so therefore it's hard for them to understand Yom Kippur. They just say, no, you shouldn't drink. I mean, even if someone has a regular flu or something, or just a chodesh sakana, they say you must drink, and it's very hard to. So what's the gedder? How do you get a clarity of how you can have nemonus with that?
Oh, again, the Shulchan Aruch steht, a goy hot nemonis. That's number one. We have to have this in mind. I mentioned before that it's kedai to take a Shomer Torah mitzvahs because he knows the chomer in of Yom Kippur. Correct. On the other hand, some doctors, like you say, they want to cut to the ground. But if you sit down with a doctor, your doctor is a doctor which is a goy. You cannot change your doctor just before Yom Kippur. You have a goy which is a doctor. You explain him. You have to understand. Yom Kippur is a very big thing, and if I don't need, I'm not going to sue you, and I'm not going to, you have to tell me the truth. Don't, put it on the table clearly. You will give an answer. But if you can't get out an answer, I would suggest like this. If you feel that basically he has no problem that you should fast, but he wants to cover himself, I would say speak it over with another doctor, which is Shomer Torah mitzvahs. Give him the background, and let's hear what he has to say. But if you cannot have such a thing, you have to rely on the goy. You have to rely on his nemonis.
Same. What happens if someone says, so in Shulchan Aruch...
I will tell you a very interesting thing. I know a person which had cancer, Rahman al-Islam, and she was over already with the chemo, but not too long. She had she was over, and most of the Rabbanim said she shouldn't fast. And the doctor said, I have no problem to fast. Today's the Bechlal, the Ktoiram, the doctors there's a big shitter that it's a healthy thing to fast. Although by them fasting means drinking water, food, but Bechlal, it goes more and more to the Nikida that they have they won't, they don't have a big problem of fasting. So again, if you could talk it over with the Dr. Shomer Torah mitzvahs, that's fine. But then if it comes to the case that you don't know, and you cannot, then you have to rely on the doctor.
And what's the gedder? How do you guide someone? I've had a question before when someone is not feeling well, but they're fine, or some embarrassed, whatever the case is, and they say to me, I'm going to be home, but what happens in the middle of Yom Kippur if I feel very, very bad, and I think I'm a psycho? What's the guidance to give someone that, I need tzarich? What does I need tzarich mean? What is that? What's the gedder?
This is a very good question, because a lot of people, they are afraid, and they don't, if a person which is at home, and she gets very dizzy, lightheaded, then she should know that she might have a problem. Okay. Again, dizziness, if I'm pregnant, if she gets lightheaded, in dizziness, really weak, she has to lay in the bed and she feels, then that's already a sign that there's a problem.
You talked about taking a pill if you have to with water, making it bitter. You mentioned salt. Is vinegar also an eitzah? Can you put in vinegar into the water?
Vinegar in hot water, nobody drinks, I assume. But you have to make it really, it should be a mar, yes.
Okay.
But putting in lemon, I once heard somebody say you're putting in lemon juice. Lemon juice is not considered, people eat it.
And one more thing before I want to give people a chance to ask questions as well. Just, I wasn't clear about the headache. So if a person's a chole she'ein bo sakana, and he can't, it's impossible to take it without water. Can he take it with a little bit of water if it's bitter?
If it's bitter, you can take a little bit of water, yeah.
And if it's a strong headache, that's not a chole she'ein bo sakana. Unless it's...
No, he's not a chole she'ein bo sakana.
Right.
If he's not a chole she'ein bo sakana.
Women who taking, but to take it without water is still okay. Even if you have a strong headache, you can take it without water.
Yes, if you have a strong headache, you can take it without water.
And if you have medicine that you can't miss, like a woman is taking contraceptive pills and doesn't want to miss.
Oh, I wanted to say it, I forgot it. Yeah, there's also a very good question. But a lot of times, a person has to take everyday medication. Now, he has to know if it's a medication, for instance, a person who takes medication for high blood pressure, there is no problem. He has to take it every day, but there's no problem. He should take the dose before he starts the fast. And he could stay the other one, he could take once the fast is over. So although he has to take it every day, first of all, you could skip one day. It's not advisable, but technically you can skip one day. But even if you cannot skip the day, if the doctor will say that you can take it erev right before the fast, and you can take it right after the fast, then you solve the problem, you don't need to do. Now, but there are some medication which you have to take a specific time. You have to take a specific time. Now, if you are a chole she'esh b'skuna, of course, you have to take it. There's no option. You don't play around with it. But if it's not a chole she'esh b'skuna, for instance, you mentioned contraception. Contraception is not a chole she'esh b'skuna. In contraception, even though that she has to take it, the answer for this is, which I spoke it with the doctors, and a couple of doctors gave me the same solution, that although if she takes it every time at night, every night she takes the pill, then there's no problem. She should take it right before the fast begins. That's considered the regular night. There's no problem. But if she takes it every time in the morning, so they advise that you take it erev Yom Kippur in the morning, then you take a half a pill before the fast, then you take another half a pill motzi tanas, and then you take it the next day a regular pill. And if you want, you can take also a full pill, motzi Yom Kippur. That wouldn't have any effect. Again, a person which takes it at night, she could take it before Yom Kippur and take one motzi Yom Kippur. You have nothing what to do. There's no problem. A person which takes it every time in the morning, but then it's already a problem. She's going to skip a full day and she cannot skip a day. So the solution is take right before Yom Kippur another extra half a pill. And motzi Yom Kippur right away, you take an extra pill or a half a pill. This depends on which doctor, and you shouldn't have any problem. And even though she's gonna have some staining, that's not a reason. That's not a reason to take a pill on Yom Kippur.
Does anyone else any other questions? No.
No. Okay. So the Rebbe should
help. Sorry. I had one question. Regarding someone who every Yom Kippur, by the end of the day, they get so sick that they start vomiting and chole lemishkav. At which point do we say pachot? It's every year. She's a woman who's very thin, and every time she fasts, without every Tisha B'Av, by the end of it, she's vomiting and very ill. At which point do we say, listen, this is too much, and go pachot from?
What does it mean? The end of the times. What does it mean?
By mid-afternoon. By 2 o'clock in the afternoon, she's it's not only headache and dizziness, but she's actually vomiting.
Constantly vomiting.
Constantly,
but if she constantly vomiting, you have a problem. She might get dehydrated. Then you'll have to give her pochas mikashir.
But can I do that? Say to her, listen, because this is going to happen. It happens every single fast. So say, all right, start pakod, so she shouldn't have to be in that matzav. I'm saying,
Yeah.
so
Why should you start earlier? If she's going to come to a matzav that she'll have to drink full, more than the shear, then you say start right away in the morning, puchs mikashir, because now with puchs mikashir is only a drabonan, and you're avoiding not to eat a full shear, which is a deraisa. But if in any case she's going to eat puchs mikashir, why shouldn't you wait? When she comes to a matzav that she needs to take it, then it's mitter. If she's not in the matzav, then she's not mitter.
Thank you very much.
Just can I ask just one thing? You talked about someone who's got depression or nerve and anxiety, whatever, so they should they need to eat pochs kashir. But there are people, I one or two people that have very severe depression, and I'm just, if I tell them to start playing around with their menu, I'm worried that they're not going to do the right thing and they're going to get into a problem. Is it better?
They should eat regularly. Yeah, there are some people which are going to start, people who have depression or nerve problems. Or, you know who else? Anorexia. A person which is anorexia, you eat regularly. These people should not, if they have such a person, yes, he should eat regularly, because he gets really schooner. Of course, yeah. I only said the person who takes medication for this, that's a lie. But once you have these people, which is, the same will goes to a person which has Alzheimer's. If you're going to start messing around with him, you have to give him regular teeth. But by Alzheimer's, they say it's bechinas shoita, so he's basically he doesn't have to fast. But you shouldn't give it to him in his mouth. He should eat for himself. But again, if you have a person which is going to mess up his whole life, and it's a scholar, then of course he can eat regularly. Yeah.
Very good. Rabbi Oberlin, große shakach, and machst mit and a good bench to Jahr, and was lang sein gesund.
Amen. Ik zie we zien met Teuve en Ashuna Teuve Mesike, and we should have a new year, a gesinte year. The Haishnas Areni Peluas, you should see a lot of wonders. And states from Tzadikim that if you learn the halachas before the Yom Tov, you don't come into shilas. So we shouldn't have any shilas, serious shilas, and everybody should be able to be mekayim the mitzvahs aseh daraisa, healthy and normally, and you should all have a nice and beautiful Yom Tov. Kol Tov.